Now it's time for the last word with Lawrence O'Donnell. Good evening, Lawrence.
Good evening, Rachel. And I invite viewers to compare what they learned from Ron Klain in your last 45 minutes of discussion to what they've been hearing from Trump administration officials, not the medical professionals, but the actual White House staff, because that's what Ron Klain was in the Obama White House. He was in a position without medical expertise, but with expertise about how to make government work, how to make arms of the government work together in a crisis like this. And of course, he did pick up a great deal of expertise about this kind of situation and about the medical elements of this situation. And I haven't heard anyone from the Kellyanne Conways to the Larry Kudlows to these Trump appointees within the White House who have anything like the command of this subject that Ron Klain has in one sentence.
Not only the lack of command, but the overt politically convenient disinformation. Those two people you just cited, Kellyanne Conway and Larry Kudlow, both saying this is contained. Kudlow saying almost airtight. You know, as the number of U.S. cases started low and headed toward over 1,000 where it is now, the overt disinformation from the president on down is actually one of the serious challenges that we've got as a country in terms of how we're going to deal with this. And I don't think anybody was under any illusions that they'd handle this well. I'm not sure that any of us were cynical enough to expect that they would handle it so overtly badly that they'd be one of the problems we needed to fix along the way.
And Rachel, the basketball theme that went throughout your hour, it's at least 2 weeks ago, maybe more, that an official at one of the really big basketball powers in the university system in this country said to me that he was very worried about what this meant, not just for college basketball games with 20, 25,000 people watching them, but what happens if one student in there is then tested and found to be ill. What do you do about the 25,000 people who are in that arena? Clearly, the NBA has been thinking about it in this announcement tonight that they are suspending, and it's suspending. It's not necessarily ending. Perhaps they're suspending for 30 days. Perhaps the NBA season will finish in August this year. We don't know. But this is really the first really big decision about limiting large groups of people in enclosed spaces.
And it feels like they hit it like slamming into a wall. Yeah. I mean, the NBA was not exactly, engaging with this possibility in a way that seemed particularly open-minded. But then you saw a bunch of things happen in very quick succession. You saw Tony Fauci in Congress today say overtly, we don't believe that Americans should be in large crowds right now. And if this means that NBA games should be played with no audiences, then so be it. We then saw in San Francisco, the mayor institute a ban on gatherings of a size that would exclude events like an arena full of people watching the Golden State Warriors play games. We saw this start to happen in individual locations. And then in this Thunder game tonight in Oklahoma, it turns out a player from the Utah Jazz is perceived to potentially be positive. That apparently was a calamity at the Oklahoma Thunder Stadium or arena tonight in Oklahoma City when they instituted at first a 30-minute delay. Nobody there knew what it was for. Then they announced the game would be postponed. And only after they announced the game would be postponed did we find out that the answer was about a player from that visiting team. And so it feels like we're sort of stumbling through this. But in the end, we're all coming to the same conclusion about canceling large events now.
And Rachel, the idea of, OK, the basketball games will be played without the audience in the arena. There's a real business to be done that way. The television side of the business, there's obviously still a very viable business to be done without the ticket sales, unless a player contracts the virus, which is where we are now. I mean, the amount of physical contact, your hands can't touch your face. Well, you sure can't play basketball with other people if that's the case. And so all they needed was that one player, and they just did what you would do, thinking about that one player, project that out. How long has that player been carrying this? How many other players in the NBA has he actually literally touched in just, say, the last week?
And those calculations, as Ron Klain was saying, if we were in a regime in which, like they are in South Korea, in which there was widespread testing, in which not only was everybody symptomatic getting tested, but everybody who was a traced contact of anybody who was known to have the virus was getting tested. And there was just widespread surveillance testing within the population to ferret it out in places that we didn't know about, then you'd be having a completely different conversation about the sort of workplace risk to NBA basketball players than you would in our country, where it is a mystery because the federal government, the Trump administration, blew it, just absolutely blew it when it came to us having tests. And so we're the biggest industrialized nation in the world dealing with a significant epidemic while flying blind with no information that you need to take the first steps to make sure this thing gets brought under control. It's just absolutely unconscionable.
And Rachel, just one more thing before you go, and this developed during your hour, one of the breaking news elements of your hour. And by the way, the president's 10 minutes was a complete contradiction of everything the president had said publicly about this prior to his 10 minutes tonight, when he was telling people there was nothing to worry about. But I think America tonight has a symbol, a couple of big symbols about what there is to worry about, with the NBA suspending because of one of the players. But then that news that you broke during your hour of Tom and Rita Hanks in Australia, Tom Hanks tweeting out tonight a very upbeat statement by Tom Hanks about himself being infected with the coronavirus, and his wife, Rita. And of course, Tom Hanks is going to put a very brave face on this, which he has done. And I hope all of the kind of positive feeling that he conveys in his text about, in his tweet about how this is going is true. I'm sure it is. But that's a real face now. That Tom and Rita Hanks is a real thing, a real fact for Americans to consider. If it can happen to them, even though they are in Australia, it can absolutely happen to anyone. I think that's a reality now through Tom Hanks that a lot of people might not have had without Tom Hanks' announcement about this tonight.
And for that to be happening while Mr. Hanks and his wife are in Australia, which is where they were diagnosed, which is key to us learning this, because that's why likely they were able to get diagnosed, because they were in Australia and not here. Who knows how they would have been able to get access to a test here. But the president tonight issued a travel ban from Europe as the way he's going to try to address coronavirus in this country, because he knows how to do travel bans. I mean, how about Australia? That's where Tom Hanks and his wife appear to have it. I mean, this dartboard approach, this blind throwing darts that he's doing in terms of trying to make it seem like he's got some sort of rational response here. Schengen area countries from Europe will be restricted in terms of their travel from the United States starting on Friday, and we're excluding the UK, where their health minister just tested positive. It's just it's random action at a time we need concerted, smart, science-driven action.